Proper glycemic control in cardiac intensive care unit patients decreases mortality. Diabetes is one of the most common lifestyle disorders. Diabetes is associated with long-term complications that may affect the course of hospitalization and patient's outcome. This study was performed to evaluate the role of in-hospital glucose control on the length of stay, 30-day mortality, and 1-year mortality in patients admitted to the cardiac intensive care unit. Patients who were admitted to cardiac intensive care unit and had diabetes were included in the study. The retrospective study included 370 patients who were divided into two groups based on their glucose status. Controlled glucose status group included 166 patients, and uncontrolled glucose status group included 177 patients. Duration of hospital stay, 30-day mortality, and 1-year mortality were evaluated. The duration of hospital stay was shorter in patients with controlled glucose status group as compared to patients with uncontrolled glucose status group. The 30-day mortality rate was lower in patients with controlled glucose status group than the patients with uncontrolled glucose status group. The rate of 1-year mortality was significantly lower in controlled glucose status group as compared to uncontrolled glucose status group. The study results concluded that control of glucose parameters during hospitalization is associated with a shorter hospital stay and decreased 30-day and 1-year mortality. Therefore, glucose levels should be carefully maintained to reduce mortality in critically ill patients.